From Colorado's news leader, this is 9 News Saturday Morning.
This week is Eating Disorder Awareness Week, and the Eating Disorder Clinic of Denver is trying to bring recognition to the disease through a new study. The results of a 2-year study have been released, and it reveals that the number of middle-aged women with eating disorders is on the rise. Called the desperate housewives syndrome, 94% of the women studied admitted to having a disorder when they were younger, and that they relapsed or their condition got worse later in life. For more information on this study, we turn to Dr. Carolyn Ross, the director of the Eating Disorder Center of Denver. Dr. Ross, this is the first study of its kind. Can we talk about the desperate housewife syndrome? Why did you name it that?
We named it the desperate housewife syndrome because it really points to how the media impacts our image of what middle-aged women should look like, that they should be very thin, that they should look younger than their age. And so this is why we named it that.
Certainly something a lot of women can identify with. What are some of the other reasons that you think you're seeing an increase in the number of middle-aged women who have these eating disorders?
Well, first of all, you know, we have a bumper crop of baby boomers who are reaching middle age. Many of them had eating disorders when they were younger. As well, there's an increased awareness of eating disorders, so we're diagnosing the condition more often. And there have been some medical advances that have enabled eating disorder patients to live longer and therefore to reach middle age.
Now, something in this study was really interesting. It showed that middle-aged women and teenage girls with eating disorders had some of the same personality traits. What are some of those traits? What can we look for?
Well, personality traits, as you know, are innate or inborn. They're genetic. They can be modified, but they usually can't be completely eliminated. Things like shyness. If you're a shy person, you're likely to be a shy person most of your life. Being very cautious or perfectionistic. These are some of the things that we're seeing that are the same in our middle-aged patients as are in the younger patients. And even though one of the middle-aged people with eating disorders may be in her 40s or 50s, they may only have the emotional maturity of a teenager or a 16-year-old.
Since so many of these cases involve relapsing, what are some of the things that you can look for in yourself or in others if you suspect they or you may have an eating disorder?
Well, certainly we want to look for changes in weight, sudden weight loss or large amounts of weight loss. Also personality changes such as isolating behaviors, becoming more moody, more focus on their body or body image issues. All of those are indicators that someone may be developing an eating disorder or may be relapsing from an eating disorder.
Okay, and you say approach cautiously, be sensitive if you do say something to them about it.
Absolutely, and do it with compassion and give them a chance to express their concerns while you express your concerns for them.
Dr. Carolyn Ross of the Eating Disorder Center of Denver. Thank you so much, Dr. Ross.
Thank you for having me.
You're welcome. Now, if you or someone you know may be showing signs of an eating disorder, we're offering help this morning. We have our Line 9 open, 303-698-0999 from 7:30 to 9 a.m. The Eating Disorder Center will answer any questions you might have concerning eating disorders and how you can help yourself or someone you love. Again, that's from 7:30 to 9 this morning, and we'll be right back.